Hi, my name is Libby, and I crawled out of the swamp today because I care about women. Today, I thought it would be fun to answer a few questions that I saw while scrolling through the subreddit r/womenshealth. I personally think that there is a lot of conflicting and confusing information out there regarding care for the female body. And something I intend to use this platform for is to clear up confusion that I see from women regarding their bodies and their needs. Something that I firmly believe as a public health professional is that part of my expertise as a public health professional is the ability to take complicated medical health or well-being information and translate it into something that's simpler and easier to understand. I took entire classes on health communication and plain language, and it's one of my favorite areas of public health that I've studied. So I'm really looking forward to this video. I think I'm going to have fun. The questions in this video are lifted directly from the Women's Health subreddit and are edited for clarity, grammar, and privacy. So without further ado, let's get it. Our first question is as follows. Call in sick for a UTI? ? I called in sick from work today for a UTI and now I feel kind of bad. I work retail doing 5-hour shifts where I can't really leave the register. I'm on day 4 of my antibiotics and it's getting much better, but I always find that I feel worse after working. Me too. I went in for a shift yesterday and the pain got really bad because I couldn't really go to the bathroom at all. It was nonstop customers and I had no time. My UTI was better this morning, but I worried going in would have made it worse. Is it justified to call in sick for UTI symptoms, even if they're mild? I've had this UTI for like 2 weeks now and haven't been pushing through the past few days. Slanty face. I'm on probation, so any lack of attendance kind of sucks. First of all, my thoughts and prayers are with you. In this trying time, having a UTI is really rough. So to understand the full context of this question asker's situation, we have to understand what a UTI is. A urinary tract infection, or a UTI, is, like it sounds, an infection in the urinary system. Your urinary system consists of your kidneys, which make your urine by separating waste out from your blood, your ureters, which are 2 little tubes that carry the pee from each kidney into your bladder, your bladder, a balloon-like muscular organ that holds your pee until you're ready to use the bathroom, and your urethra, which is the tube that you pee out of. These infections are considered to primarily impact women and assigned female at birth people because we have, to put it clinically, a lot going on down there. Your urethra is a little almost invisible kind of hole between your clitoris and your vagina. The female urethra is very short. It's literally like an inch long or something like that. The female urethra is very short. It's between like an inch and an inch and a half. And that makes it easier for bacteria to get into the urinary tract via your urethra, which is really the only external exposure that your urinary tract has. The most common cause of a UTI is the presence of the E. coli or Escherichia coli bacteria in the bladder, urethra, or elsewhere in your urinary tract. This is because if you have a cooter, your urethra is very close to your anus, relatively speaking. There's a couple of things in between them, but they are basically neighbors. E. coli, you may know or recall, is a bacteria that is found in poop. So your urethra is near your anus. E. coli causes UTIs. You can kind of do the math. This is why it is important to pee after sex, and why it is important to wipe from front to back. These will both help to prevent E. coli from being introduced into your urethra and help to flush out any bacteria that might have been introduced before they can get comfortable and start multiplying, which is what ultimately causes infection. So during sexual activity, bacteria from the anus can very easily get introduced into the urethra from the poking around down there. And if you wipe from back to front, right, then you're starting at the anus and then you're wiping like this. Well, you don't want to do that, because then you're getting the bacteria from your butt into your vagina and into your urethra. Your vagina does not want your butt bacteria. No, that's not going to work for her. And it's definitely not going to work for your urethra. So you want to, they say from front to back. Personally, I think it makes more sense to say from top to bottom, just because of like angles and sitting on the toilet and stuff. But either way, the proper order is urethra, then vagina, then butt, just so you know. So a UTI most commonly impacts the bladder and the urethra, but it can spread into the kidneys. That can be very dangerous, so UTIs must be caught and treated quickly. In addition to having potentially severe consequences if they migrate into the kidneys, a UTI that is localized to the bladder and urethra is still very painful. A UTI can cause uncomfortable symptoms like urinary frequency, which is what we call peeing often, usually only passing small amounts of urine. Urinary urgency, which is the feeling that you need to pee right away, immediately, as soon as you realize that you need to pee. An urge to pee that doesn't go away, even after you just peed. A UTI can cause that. A UTI can cause painful burning. Painful burning when you pee. UTI can cause urine that looks cloudy, urine that is red, bright pink, or a dark brown kind of Coke color. Urine that smells very strongly, pelvic pain, and also lower back pain. So there's a lot going on there. It's also important to note that in women who have already finished menopause, so in postmenopausal women, UTI can be a very serious condition, and there are additional risks of complications. Older women can experience all of the symptoms I just listed, but are also at risk for developing confusion or delirium, which would be either not understanding what is happening or believing things are happening that are not happening. They also are more likely to develop a bladder infection, a kidney infection, or sepsis. Sepsis is the term for when you have a very severe infection and your immune system freaks out trying to fight it, causing your blood pressure to drop, which damages your organs because they're not getting enough blood. UTIs can be fatal if left untreated, the same as any other infection. So, knowing all of this, that takes us to the key point, which is that if you have a UTI, you are sick. A UTI is agreed upon to be very painful by those who have experienced one. I've had more than a few. I've had my fair share, and they're oh my God, so painful. You should call out of work sick if you are sick, and if you have a UTI, then you are sick. It's like a transitive property thing. The question asker even says that she went into work the day prior and her symptoms got worse and she was uncomfortable. Lastly, your job does not care about you. They don't care about you. If your UTI resulted in a more serious infection and you were left unable to work for an extended period of time, which is entirely possible, by the way, then your work would replace you. Your job would replace you. Call out of work if you don't feel well. They will be fine. The world will keep turning. Our next question is titled, I've gained weight. I'm a 21-year-old girl who has been in a healthy and happy relationship for almost a year now. Congratulations. I eat 2 to 3 meals a day with an occasional snack. I like walking and dancing, so I keep active more or less, but I'm the heaviest I've ever been in my life. I feel like I look fine, and I feel fine, but my pants don't want to fit like they used to. I know that there's a thing called second puberty that women go through, so I just want to know if other women have experienced this around my age. So the question asker here is a 21-year-old girl who has put on a little bit of weight, ultimately feels fine about her activity level and her body image. She just wants to confirm that she doesn't need to be worried about anything and that this is normal. It is. It's totally normal. As you enter adulthood and exit being a teenager, your metabolism slows considerably. Even if you finished growing height-wise at, say, 16 years old, your body was still doing a lot of developing that you probably could not see. During that time, your body is burning calories without even thinking about it. This is partially why teenagers eat so much. I was so hungry all the time when I was a teenager, and also partially why they sleep so much. And even though in the United States, you become an adult when you turn 18, that doesn't mean that you're done growing or developing yet at that point. Think about how we always say that your brain is not done until you're 25. All this is to say that as you transition from teenager to adult, your body transitions too. A teenager's body is not an adult woman's body. When you got your first period and your mom told you, you're a woman now, she was wrong. Now that you are done growing, your body is preparing itself to give birth, which is what it wants to do really, really bad. Part of that preparation will include storing some extra weight. There is an idea, made very popular by TikTok, that women undergo a, quote, second puberty in their mid-20s. I think that that's really oversimplifying things. And also, just so you know, there's no official medical term called second puberty, nor is there an official medical term that describes a, quote, second puberty. It is more accurate, in my opinion, to describe this phenomenon as the ending of your adolescence. You are going through and in your adolescence from puberty into your 20s, and the second puberty is really just the exiting and leveling out of the effects of the first one. Am I making sense? So the way the human body sort of works is you are in your adolescence, and then your adolescence ends, and then you begin aging. And that's really what is happening when you hit that sort of second puberty, is you have finished adolescence and you have begun aging. And that is okay. You need to just embrace it. It will be so much easier to deal with if you just embrace it. So I push back against the term second puberty because I feel like it creates this idea that you are going through these specific changes at this specific time. But really, what you should expect is that your body is going to continue to change throughout your entire life. You will never not be aging. You will experience changes to your hormone levels, your fertility, your menstruation, your feelings and your emotions, your skin, your weight, and more throughout your entire life. All of this is to say that it is totally normal to gain weight under the circumstances that the original question asker described. If you gain a significant amount of weight in a short amount of time, you should definitely ask your doctor about that. But to still be able to fit into your jeans, they just don't fit quite the way that you enjoy for them to. That's just part of getting older. And that's okay. That's totally fine. Our next question was titled Doxycycline Vaginal Odor. It's been almost 2 weeks since I finished my meds, and the odor is worse than I've ever had. I would say I do have a bit of odor, but never this bad. I don't have any symptoms of a yeast infection, as I know that could happen after taking meds. Just smell. Any advice on what to do would be very much appreciated. So, first, we need to know what doxycycline even really is. Doxycycline is a type of antibiotic medication. Period. Doxycycline is a type of antibiotic medication. Antibiotic medications are ones that are used to prevent or treat infections caused by bacteria. Doxycycline is most commonly prescribed to fight off bacterial infections, urinary and respiratory tract infections, eye infections, gum disease, gonorrhea, chlamydia, and syphilis, which are all caused by bacteria. Doxycycline, like all antibiotics, works by either attacking bacteria within your body or stopping them from reproducing. Doxycycline specifically does not attack the bacteria directly, but rather it inhibits their growth. This means that it stops bacteria from being able to reproduce within your body. This is great for fighting off bacterial infections like some of the ones that I just listed. However, your body does have good bacteria that it needs for some of its functions, and doxycycline inhibits their growth too. For example, your gut microbiome is made up of good bacteria that helps you digest your food. Just like your gut, your vagina has a microbiome. She needs specific conditions in order to keep doing her thing the way she's supposed to. Think of your vaginal flora as your vagina's version of lo-fi hip-hop beats to relax/study to. She needs them in order to do her work effectively. Or he. Your vagina can be a boy. That's not my business. That's for you to decide. So, doxycycline inhibits bacterial growth, and your vagina has some bacteria in it that it needs in order to keep itself in check. Specifically, your vagina is home to a type of bacteria called lactobacilli. These secrete lactic acid and hydrogen peroxide, both of which help give your vagina its normal, slightly acidic pH level. This is also why your dark panties eventually turn white in the crotch. Fascinating stuff. Your vagina also is home to a species of fungus, don't let it gross you out, it's normal, called Candida. The lactobacilli and the Candida need to stay within a balance of one another in order to keep your vagina at that slightly acidic pH balance sweet spot that I was just talking about a second ago. However, when you are on antibiotics and your vagina's flora are either being attacked or prevented from replicating, this balance gets out of whack. You end up with too much candida typically, which is how you get a yeast infection. Or you can end up with too much of the wrong bacteria, which also throws your pH off and will also result in an infection, bacterial vaginosis, which will require antibiotics. It can be a vicious cycle. So to answer the question, yeah, this happens. It is preventable to a point. It is fixable. It does still suck. When you are taking antibiotics, your doctor will usually encourage you to take a probiotic with them. In the past, when I have been prescribed doxycycline specifically, I'm allergic to penicillin. My doctor has usually prescribed me an oral yeast infection treatment just as a preventive measure because yeast infections with doxycycline are so common. Doxycycline is a pretty powerful antibiotic. Taking in probiotics will help you to replace the good bacteria that is killed or inhibited by the antibiotic. Doxycycline's most commonly reported side effects do include vaginal itching and discharge. She says that she's not having any yeast infection symptoms, so we can assume that she's not having any weird discharge. She's not having any itching. She's not having any issues with like dryness or anything like that, because that's what's really cool about a yeast infection is simultaneously you're having this weird discharge and you're super dry and like irritated. Nature is amazing. But she says that she has a funky smell going. And after finishing that, after 2 weeks, if I still had a funky smell going, even with no other symptoms, I would still talk to my doctor. But she probably is not that uncomfortable, which is good. I would not wish a yeast infection on my worst enemy. It's really terrible. They're really terrible. Next, we have synthetic panties, ? If the material on the panties is something unnatural, is it okay to wear them if the lining on the inside is cotton or another natural material? Why do you need cotton panties? Well, it's generally recommended to wear cotton panties for a few reasons. One is that your vulva is very sensitive. It's like as sensitive as your face. So your vulva is very sensitive, and cotton is a soft, gentle fabric that, generally speaking, does not cause irritation. The other main reason is that cotton is breathable and absorbent, so it doesn't trap moisture near the skin of your vulva, which you don't want that. Trapped moisture can cause irritation or pH imbalance, which can lead to both bacterial infections and yeast infections. So the idea behind wearing cotton underwear is that it will let your vulva air out or breathe, for lack of a better term. But is it okay to wear nylon or polyester underwear if the crotch, which is called the gusset, I learned recently, is made of cotton? It is better than it would have been to wear underwear that was made entirely out of a synthetic material. I won't act like I don't have a few pairs of synthetic underwear with a cotton gusset, because I definitely do. However, it is not going to offer you the same level of protection from irritation as underwear that is truly made entirely of cotton. And it's not enough either for it to be like a natural material. It should really be cotton. It should really be cotton. The gusset might be made with cotton, but that's usually like a lining that is sewn to the synthetic outer shell piece of the underwear. So yes, what's near your skin is breathable and absorbent, but how can the fabric really breathe when it is attached to an outer non-breathable fabric? For that reason, I'd say it's probably not your best move to wear this type of underwear every day. Like I said, I have a few pairs like this, but they don't get worn if I'm dealing with any type of irritation at all down there. They don't get worn if it's really hot outside that day, and they don't get worn every day or even multiple days in a row. If you are going to buy some underwear like this, I'd advise you to stick generally to those guidelines too. Also, just while I'm here and I'm handing out advice, personally, I sleep without underwear and I let my situation air itself out. My gynecologist recommended this to me and I recommend it to everyone else. It has made a really big difference for me in terms of like, I don't really chafe as easily down there anymore. My skin is a lot less irritated. I'm just a lot more comfortable. So I really do recommend that as well. This brings us to our last and our most fun and our most interesting question. Is it normal to only orgasm once? Sorry if this is a dumb question. It isn't. I can only orgasm from my clit one time. If I continue right after, or even a few minutes after, it hurts so bad. I feel no pleasure from it at all. All of my urges are lost too. I was wondering if this was normal. Yeah, that's like totally completely normal. But why would someone think that this isn't normal? Well, some women can orgasm multiple times. Lucky them. According to the International Society for Sexual Medicine, most women could have multiple orgasms, but only about 15% of women actually do have them. If you wanted to explore with yourself or with a partner and set out to have multiple orgasms, that's probably something that you could do. It's certainly something that you can work towards and try. I don't think that you should expect it to happen the first time you try it. I think that you should expect to have to work towards it, probably repeatedly. Having an orgasm as a woman is complicated stuff. A lot of it is mental. A lot of our arousal is mental. And having an orgasm for many women takes a specific combination of focus and relaxation. Some women say they need to be flexing their pelvic floor muscles to orgasm. Some women orgasm vaginally. Some women can't do that at all. Some women can do both. Some women can do one of each. Sex is different for everyone. The best way to enjoy sex is to get out there and figure out what you like. It really does take exploration. You can figure out what you like alone or with a partner. Once you know what works, communicate that to your partners. One piece of advice that I have is to remove the pressure from yourself. Don't set out to have an orgasm or multiple orgasms. Set out to figure out what feels good and then give your body more of that. Make the process of experimenting the main event rather than the end goal of having an orgasm be the main event. Enjoy the journey. That's all I'm saying. You can also check out the subreddit r/becomingorgasmic, which I got distracted and scrolled through for a solid hour while I was working on this video because it is fascinating stuff. It's just chock full of women giving tips where they're like, I couldn't have an orgasm, and then this is what I figured out worked for me. I have multiple orgasms, and this is how I do it. It's just full of people being like, try this, try this, try this, try this. I guess I don't have like a scientific fact for it necessarily, but I don't really believe that there's anybody out there who just straight up cannot have an orgasm. You can probably. I know certain medications can make it difficult and stuff like that, but scroll through those tips and try them out. What is it that they say? There's like a thing like in science, right? Where it's like, even if I do something, if I set out to prove like a link and I prove that that link definitively does not exist, I've still learned something. Like you can, I'm a big proponent of just getting out there and experimenting. Figure something out, you know? Go do science. Thank you so much if you have made it to the end of this video. I really appreciate it. I make casual and conversational videos on topics relating to the health of women every Friday. See you next week. Bye.